While many lift devices appear quite different, most lifts perform similar functions and require the same basic considerations for use. While using any form of lift device or sling, please consider the following. Regardless of the brand or manufacturer, all lifts utilize a handheld control for basic functions. Portable or floor-based lifts utilize a battery and must be charged. Some lifts plug directly into the wall for charging. Others may require the battery to be removed from the lift and placed into a charging station. Most lift devices feature a red button or pull tab used to activate the emergency stop feature. On most portable lifts, the emergency stop is activated by pushing the red dial or button in. Once engaged, the lift will not function or charge. To disengage the emergency stop, twist the dial counterclockwise. For overhead or ceiling lifts, the emergency stop is usually a red cord. Prior to using a lift and sling for any patient mobilization task, please inspect the sling for any signs of tears, fraying, or damage. If the sling is in question, do not use and replace with a sling in appropriate condition. Before lifting any patient with the lift and sling, compare the patient's weight with the weight capacities of the lift and sling to ensure compatibility. Do not use a lift or sling if you are unsure of the weight capacity or if the patient exceeds the weight capacity. To use a seated sling, the patient must be able to tolerate the seated position. If the patient is already sitting in a chair, the sling may be placed behind the patient by instructing or assisting the patient to lean forward in the chair. The sling is tucked behind the patient to the small of the back or gluteal cleft. The sling is not placed under the patient's bottom. Once the sling is tucked, the patient is assisted to a normal seated position, leaning against the back of the sling. The legs of the sling should be pulled taut to ensure there is no bunching or wrinkling that could irritate the patient's skin. The legs of the sling should then be guided under the patient's legs in smooth, gentle movements. Some slings cross between the patient's legs. Others are designed to scoop both legs and do not require crossing between. It's important to ensure the sling is always pulled taut and that the sling is free of any bunching or wrinkles. Once the sling is placed, the portable lift device is moved closer to the patient. The carry bar should be placed directly above the patient's torso to allow for proper sling attachment. Starting at the head, attach the same sling loop or color on either side and work your way down toward the patient's feet. A short strap or loop at the head and a long strap or loop at the feet will keep the patient in a seated position. Once all the sling straps have been attached to the lift carry bar, slowly raise the lift until there is tension in the sling straps. Stop and recheck all the sling straps to ensure they are secure and that the patient is comfortable before continuing the transfer. If the patient is not comfortable, lower the lift and reposition the patient as needed. Once the patient is safely lifted out of the chair, it may be necessary to move the chair to the side to allow room for the transfer back to bed. It's important to ensure the patient is supported by at least one caregiver during the lift and transfer. We never leave a patient unattended in a lift and sling. Placing a folded slide sheet on the bed or stretcher will provide greater ease while transferring the patient into the correct position. If the patient has upper extremity strength, you may place a limb lifter on the patient's lower extremities and instruct the patient to help guide his feet into the bed. Lower the lift, disconnect the sling, and move the portable lift away from the bedside. Once the patient is safely in bed and disconnected from the lift, raise the bed or stretcher to a comfortable working level. This should be waist high of the shorter care provider. Remove the legs of the sling and the slide sheet from under the patient. We never leave slide sheets under an unattended patient, and we do not leave seated slings under the patient in bed. The limb lifter may be used to assist the patient to sit up or lean forward to remove the sling from behind the patient's back. The sling and slide sheets may also be removed by rolling the patient from side to side. The seated sling is not appropriate if the patient has wounds on their lower back, buttocks, medial, lateral, or posterior thighs. Pressure from the sling may disrupt or irritate wounds.